Thank you so much for inviting us to be a part of the conversation today and also for sharing your land acknowledgement. I'm joining you today from Treaty 19 territory, just outside Toronto, Ontario in Peel Region, and grateful for the opportunity to participate in this conversation. And although we're meeting virtually, also acknowledging the presence of Indigenous leaders and learners and community members and colleagues as we continue with this work. And we'll talk a little bit about that, I think, as we move forward in the slides, but talk a little bit about the work that Our Kids Health has committed to as a part of Truth and Reconciliation as well. As you mentioned, our conversation today is titled Leveraging Social Media for Culturally Inclusive Parental Mental Health Support in BIPOC Families. And as a part of that, we're going to be talking about some specific contexts that might be interesting to the child right community and opportunities potentially for collaboration for some folks as well. So you mentioned earlier a little bit about us. So yes, I'm a developmental pediatrician clinically. So I see children and youth and their families in the context of neurodevelopmental disabilities and neurodivergence. That's some of my lens as we started the Our Kids Health work. So we'll talk a little bit about that as a part of our journey as well. I'm situated at St. Michael's Hospital, Unity Health Toronto. And I'll flip forward to Irina if you want to talk about yourself, Irina.
Thank you. My name is Irina, and I am a research and community coordinator for Our Kids Health at St. Michael's Hospital, where I particularly support Ukrainian community through tailored health education and outreach. And I'm currently dedicated to translated complex health information into very accessible resources for families.
And so, as I actually was saying earlier, we hope during this session to share with you a little bit of what we've learned and our journey with Our Kids Health. We'll talk a little bit about the importance of and some strategies around cultural and linguistic responsiveness for diverse communities, especially as we think about mis and disinformation in online spaces. We'll talk a little bit about the OKH platform and some strategies for thinking about how we create responsive content and resources in online spaces. You know, when we think about online information spaces right now, I think there's some important things just to kind of frame our conversation. So one important hard truth really is that we've learned, I think through the pandemic and the time afterwards, that there are really important differences in how diverse communities participate in the healthcare system. And although we're talking about diverse cultural linguistic communities, that also involves, we can think about community in any way that people may identify themselves. It may be related to a specific neurodevelopmental diagnosis, it may be related to their geography, etc. But we know that who we are essentially impacts how we participate in the healthcare system, and related to that, how we access information that helps guide our care and guide our navigation of healthcare systems as well. Another really important thing I think we've learned is that online health misinformation and disinformation is really rampant. It lives in every language and every platform, but gaining access to evidence-based or credible information is not as easy, especially for folks who don't see themselves reflected in the healthcare system overall. And you know, without getting into too much political conversation, we're seeing, you know, in our current social political environment, there are, you know, really important and scary trends that we're seeing in terms of how misinformation and disinformation impacts our patients, our clients, our research participants, and the communities that we work with. I think also really important for us to acknowledge that many Black, Indigenous, and person of color communities have a rightful, you know, well-founded mistrust of healthcare institutions, which relates to painful histories of colonization, exploitation, enslavement, experimentation, and ongoing marginalization as well. And as a clinician, I'll say, you know, the vast majority of online child health information and resources we are sending families tends to be Eurocentric and available primarily in English or French. Some resources are available in other languages, but tend to either be auto-translated or still require a high level of literacy. in terms of being able to access that information and take it in. And from a knowledge translation standpoint, some of you may have seen this number, which is really troubling, but the classic sort of number we often hear about is 17 years. So this idea that from the times new evidence is published to the time that it is implemented in widespread sort of practices can take up to 17 years. And so these are numbers kind of pre-pandemic, but reminds us a little bit about the importance of the work that researchers do and how it can be quite disparate from being taken up into actual practice for patients and communities and families. Related to that, I also want just to pause to think a little bit about people that may be further left behind. And so in our context, again, we're talking about diverse cultural linguistic communities, but thinking about where different people are in the healthcare ecosystem and how they access care and how that number may actually be longer. And the importance really of recognizing also that people from diverse communities and populations have the right to still be able to access evidence-based care just as much as anyone else, no matter what language they speak or where they live. And so there's this idea, we talk a lot about health equity overall. There's also a term that is being used more called digital health equity. And so the WHO recognizes this as a term where they describe it as a condition in which all individuals and communities have the information technology capacity for full participation in society. And so for some, that means access to a device and to high-speed internet, but at the same time, it's really important for us to think about what people are accessing online and whether the information that's available to them resonates with what their priorities are and how they take in information, what their education level may be as well, or their literacy level. So globally, this was back in 2022. This was a US study which was suggesting that adults were spending nearly 2.5 hours a day on social media. I'll pause for the folks in the room to think about where you sit compared to that number, whether it's more or less. But from a child health standpoint, 2/3 of caregivers were saying that they were looking for parenting information online. Only half found information that they thought was helpful. And more than half didn't know how to review the accuracy or the credibility of what they were finding online. And so why does this matter? It's really important to think about information-seeking behaviors, especially when it's around health information. We know that that impacts the decisions that caregivers are making. Caregiving and parenting behaviors are health behaviors because of those decisions that they make, whether it's around, like this picture is depicting toothbrushing, but also what sort of nutritional decisions to make at home, when to access medical or emergency care, how to navigate the system, and how to advocate for themselves. These are all behaviors that parents and caregivers exhibit and have direct impacts on the health of their child or youth as well. So really important to think about that, I think, is in terms of our bigger context and how people are taking in information more and more globally. So I'll pause for a second there as I take a sip of water, but I'm going to ask you in the room if you could share in the chat, as an information consumer, where do you look for health information online? And then also when you're referring the children or youth that you work with to resources online, what are some of the specific resources that you refer to, or what are some of the factors that you consider before thinking about whether something's worthy of being shared, either within your community or within your practice? So where do you look for information and what factors make something shareable for you? So we've got kind of a range of ChatGPT, we've got someone saying PubMed. Thank you, Connie, myhealth.alberta.ca. Genevieve is saying Perplexity AI instead of Google, so you can choose academic sources. Thank you for that. And ChatGPT for minor things. Great. And for folks who are typing, yeah, thank you, Tracy. So that's what I was wondering about, is when you're thinking about factors. So for either for yourself or for sharing, and Tracy sharing there that information that is easily digestible and to understand. And then Sunny is sharing their ChatGPT as well. With a link to a blog post from a friend as well. That's wonderful. Thank you for sharing that. So again, I think a bit of a diversity, and Heather sharing there as well, some official national websites as well. Really important to think about where information is coming from. Is it accessible and is it interesting? Thank you. So I'm going to close my chat window, but thanks for everyone for sharing. Yeah, so really a diversity of factors that we think about. I think within professional communities, we're thinking about credibility. I think we're thinking more and more about accessibility in different ways, and also around something that will be digestible for people in terms of their day-to-day lives and how they're used to taking in health information. And again, for our community that's in the room right now, hopefully everyone agrees, but information is really important. It can save lives, it can certainly save brains, and families and communities overall as well, in terms of the decisions that folks make around the health and well-being of their children and youth. I alluded to this earlier, but media literacy is really important, and I think overlaps more and more with the work that we all do. So I will just plug it as Media Literacy Week, National Media Literacy Week this week. And so you'll see some of our partners online sharing information as a part of a campaign around awareness. But media literacy is really the ability to critically, effectively, and responsibly access, use, understand, and engage with media of all kinds. So that can include social media, it can include news media in different ways as well. And there's some great resources through Media Smarts, which helps to really champion this cause in Canada. There are a few other terms that you might have heard. Some folks may be familiar with them. I'm just going to go through the motions of defining them for our conversation. Misinformation refers to information that's false, but isn't necessarily intended to cause harm. Disinformation refers to false information that is intended to manipulate or cause damage or harm or cause confusion. So myth and disinformation are slightly different terms there. And then infodemic, which is kind of like where we're at right now, is a place where there's just too much information. It includes credible information, but also false or misleading information, and can happen during times where there are specific crises or events. So it could be a disease outbreak like during the COVID pandemic. It could be related to created crises as well. Some of what we're seeing in the media in recent weeks as well. It can cause confusion, but really within large communities and populations, that confusion can lead to risk-taking behaviors. It can also lead to mistrust and undermining of credibility in health authorities, in evidence-based resources, and in public health responses as well. And when we think about misinformation, I think, back to early in the pandemic, there was a tone really from, I'll say, from governments, from public health authorities, initially that people who were believing in misinformation and taking it in as being, a personal weakness. And the health behaviors that they were exhibiting were being kind of highlighted as, where we had COVID hotspots, or we had, communities or spaces where people were not comfortable with taking in the vaccine initially as well. And these were there was a bit of a personal attack at times, or gaslighting happening, where this was seen as weakness, laziness, susceptibility in a way. And I think it's important for us to take a bit of a step back and think about really what is the vulnerability there. There is a lot of data from our colleagues, mostly in journalism and informational spaces, which really does think about what are the systems at play that lead to vulnerability. Why are some characteristics of people more likely to make them vulnerable to misinformation and participating in behaviors that may be leading to harm? And that includes where they take in information, what they may or may not listen to or employ in terms of advice from healthcare providers as well. So really, when we think about resilience efforts, when we think about the research that we're all creating, how do we make it come to life in a way that is helpful for everyone, and not leaving people behind, and really thinking about what are some of the factors that we can use to try to create inclusive resources there. And so when we think about that, again, around that idea of vulnerability, it's not really people who fail, but really important to think about systems, the systems that are failing. And so what are high level sort of resources or strategies that can be used? And I think that's something that Irina and I really think about in our work around what are the systems at play here that we can act on for more widespread inclusion and better health outcomes. And I'll pause in a moment, but just wanted to share this diagram with all of you. It's sometimes called a power flower. It's based on the work on intersectionality that Dr. Kimberly Crenshaw has done in the past, but really thinking about, how we've conventionally shared health information, how we've conventionally shared research findings, has really, I'll say, work to further inequity. And I think there's some reworking that we can do there. And so this flower has, a center where power, privilege, and position live, and then these different petals or different axes of identity that different people may have, where historically people who were closer to that center of the power flower had power, position, privilege, and people who were more peripheral, were marginalized. And so the idea here, when we think about how health information has been shared, is really it's been people who've been closer to the center who have decided, what needs to be shared, how it's been shared. For example, what languages are we sharing it in? Where are these research findings being shared? Who are in those audiences? And at the same time, is there a way? I'll challenge you to think about how can we democratize information in a way that is more meaningful for people? Going back to that number of 17 years from a few slides ago, is there a way that we can reset that in today's day and age, so that people across different axes of identity can have access to the latest and greatest in science? And again, just circling back and wrapping up here, the first part of our talk really around the theory behind this, but remembering that misinformation, disinformation do take a disproportionate toll. In our context, we're talking about Black, Indigenous, and person of color communities, but recognizing that there is a factor there around vulnerability to misinformation. And again, thinking about that power flower, for people who don't see themselves reflected in how our healthcare system is created or how we're sharing information for them, how we're viewing different concepts that are foundational to our work around health and wellness versus illness, how we think about disability, tends to be exclusive or Eurocentric in its underpinnings. So for folks who don't see themselves reflected in that, understandably, they could be mistrustful. They may not see themselves reflected or included in terms of whether those recommendations would work for them, whether that science would apply to them. And related to that, we know that there's a lot of data that shows that those folks that are more likely to subscribe to conspiracy theories, to be mistrustful of healthcare and research, which we know in our Canadian context is seen as an extension of government as well, for folks who may come from a place where government was not a trustworthy entity as well. So lots to think about there. I'm going to pause and shift gears and hand it over to my colleague Irina, who's going to talk a little bit about our journey in creating our kids' health and thinking about what we could do in our own little space.
Thank you, Ripo. This is where our Kids Health Network making its impact through evidence-based content for culturally diverse families. Making sure that representation and inclusivity for all are at all of our work. And we embracing the power of families and communities through our content, making sure that we share vital information that matters to our community and supporting families in making the informed decisions. Next slide, please. And this is our team. So our team of community coordinators plays vital role in connecting with families, ensuring that their voices are heard, and providing ongoing support throughout their journey as a parents. We serve as a bridge between our kids' health and the communities we serve. and we facilitate the engagement and gathering feedback and ensuring that our content remains relevant and impactful for those families. This slide represents our dedicated team of health providers that support families throughout their journey. Our network includes pediatricians, family doctors, specialists, nurses, all other healthcare professionals who decided to do their best to bring their work to social media spaces, and we are very grateful them for their impact. Next slide. Yeah, this is the sample of our content. So we do a wide range of the content from just social media posts, infographics, videos, Instagram lives. We're collecting the comments and all of the feedback possible from our community online. This is sample of the informative social media content we share. And each piece is carefully designed to provide practical advice, emotional support, expert knowledge, and it's all tailored to unique needs of caregivers and their kids. And from videos and infographics, our content is culturally adapted, so the families can trust it, and we're making sure that it's accessible and created with input from healthcare professionals. This is the sample of our infographic. So we're making sure that we split the information into digestible pieces, and we're making sure that the representation is not only in the colors and the kind of the language that we share, but also the representation is in the pictures and the photos that we use for creating our social media infographics. And the next two videos would be the sample of our content. So I'm just gonna pause for a second to illustrate to the two pieces of the content in English and in Punjabi. So this would be as a sample, so you can have this kind of feeling of what kind of content we share.
Sorry, I'm going to go forward because then it'll start playing the music right away. But here's an example of one of the English videos that are set to music. There's another one coming up that is with the provider speaking as well. This one's with me. In the sky, 'cause in the sky full of stars, I think I saw you. I'll just pause there, but that was based on some of the findings from the Positive Childhood Experiences study, where we were trying to share information on some of the key points for factors there. And then I'll just forward to the next slide, which will go into the Punjabi version of the same post.
Thank you, Ripo. So this is the sample of our infographics. So as well, like as I mentioned earlier, we're just making sure that the pieces of the content that we share is very digestible, and we're making sure that each piece of the content is adjusted to the grade 6 literacy level, so it will fit for all. The next slide would be also a video. We just wanted to share a sample of the other great video that we prepared. So Ripa, please feel free to.
Every child deserves a learning environment where they feel supported, valued, and included. Advocating for your child with a disability helps ensure they receive the support they need to thrive in school. First, learn about your child's educational rights and your school or school board's policies to understand the support and accommodations available to them. 2, build a positive relationship with teachers and school staff and administrators by having open and respectful conversations. 3, Share details about your child's needs, their strengths and goals, so that the school can better support them. 4. Collaborate on creating or updating an individualized education plan, IEP, or similar support plan for your child. Finally, stay involved by attending meetings, asking questions, and reviewing your child's progress regularly. Your advocacy can help make a big difference in helping your child succeed and feel included at school.
Thank you. And this is the process of how our kids' health works. At our kids' health, that transparency is a key to maintain the trust in the quality and the accuracy of our content. So each video and infographic undergoes the multi-step process that starts with community engagement. Then we map up the curriculum. We making sure we designed in the scripts. We making sure that those scripts are double expert reviewed. And after that, it goes through cultural adaptation and translation, graphic design, video editing, and then we will post those pieces of the content and the online engagement begins. So, and the loop will close and the process will come again. So we're gathering feedback from online engagement and basically map up the curriculum again. So this ensures that every resource we share is impactful, inclusive, and meets the diverse needs of our communities.
And I saw that there was a question in the chat from Sunny, so around some of the graphic content. So everything we create is done in-house, and so even the graphics that you saw of different families on screen were photos that we had created as a part of a photo shoot initially. You know, when we were looking for stock images of, let's say, if we were looking for a Punjabi family, it would sometimes be a very, stereotyped or exaggerated sort of view of how they would dress or what they would look like. And we really wanted to show Canadian families from diverse backgrounds, wearing their hoodies, wearing whatever they were, hanging out and being authentic and reflective of the families that we work with. And so we've done photo shoots to be able to represent that. And likewise, the color themes and palettes and logos for each of the channels is made with an artist from those communities to represent and create what we call scroll stopping content. The idea that, if you see something that resonates with your cultural identity, you're more likely to stop and take it in. So we've created those, and then the creators, the coordinators that you saw on the screen earlier when Arena was sharing it are the folks that do all of the editing and posting.
Yes, absolutely. Thank you for this important note. And one of the most powerful parts of our kids' health is hearing how our resources are making a real difference in people's lives. These voices show the range of our content, like more importantly, the impact that our content has on the real families, on educators and caregivers. So this is very important to hear back from the families and implement it in our future work. And every few seconds, a new family connects with our platform. So we've built a community of over 24,000 members. It's even growing each and every second. We all united by the goal of supporting children's health. And our content has been reached over 1 million people and has been viewed more than 50 million times. And our reach is truly global. It's families accessing our resources from over 40 countries worldwide, which is very nice to hear that our kids' house has been known around the globe.
And so
okay, I'm going to pause here to give word to Rico.
Sure. So yeah, it's really exciting to watch it grow. So like Arena was saying, we've got more than 1 million followers across our different platforms. Because we're community led, we try to think of them not as followers, but we follow their lead. So we call them community members. But in social media speak, it's followers and about 100 million views of our content since launch about 2 years ago. So very excited about the reach of this, especially for communities that have otherwise been considered to be hard to reach. And one of the pieces that we've really tried to think about in terms of our positionality and privilege is, how do we make sure that we stay true to the pulse and the priorities of diverse communities, understanding that priorities may be different. Social media or information seeking practices are different, we know, as well. And so that's something that our coordinators help with. And each of our coordinators, who you saw on that picture earlier on, has a community advisory board or social listening sort of practices where they engage with community champions or community agencies that focus on the well-being of each of those communities. When we think next about, I guess, what are some of the lessons we've learned? How do we create resources? So if you are hoping to create content in your space, some of what we've learned really is important to keep it evidence-based. So think about more actionable points. As you saw with our videos, we found that the ones that are shorter, that are very simple in terms of language accessibility and kind of action-based, as opposed to more kind of theoretical frameworks, we find don't do as well. Also, if we are myth-busting, really focus on the truth, not so much on the myth. So if you've got airtime on someone's phone or on their device and they're listening to you, important to really focus on what is the truth there. Also, as I was alluding to, important to think about accessibility in different ways. So think about who your intended audience is, go there. So if they're looking on certain platforms or have certain social media patterns that they use. So for example, for our Mandarin channel, we post, in addition to Instagram and Facebook, we also post on Xiaohongshu and some of the Asia-based platforms. So thinking about, again, where are families, where are the people that you're trying to reach? And we tend to find that shorter videos tend to work better. So if we're thinking about a busy, parent or caregiver who's maybe in line at the grocery store and is scrolling on their phone, or if they are at school pickup time, how can we create something that is positive and credible for them in their social media feed? And then as a part of it, also thinking about for folks who have limited literacy or have sensory impairments, we do, like Irina was saying, think about maximum grade 6 level of literacy for the language that we use, and think about videos that are both spoken, but then also with captions. We tend to find that a lot of our videos from the metrics may not actually be listened to with the sound on, depending on where people are. So having the captions below is really important. There are other things we could share as a part of some of those learnings around accessibility best practices as well. Really important also to think about keeping it trauma informed and culturally and linguistically adapted. As I was saying, representation on screen really matters to the communities we work with, and it helps to rebuild some of that trust that we were talking about in terms of our hard truths part earlier as well. And thinking about subpopulations, you don't have to create content for everybody, but thinking about really who is that intended audience, and thinking about caregiving practices, healthcare decision-making practices. We know for many of the communities that we work with, there are multi-generational caregiving practices where families have told us, kind of like in one of the quotes that Irina had shared earlier, where content may be shared with grandparents, maybe with siblings, or aunts or uncles or other folks who may be involved in thinking about health, well-being, and practices within different families and households too. And then going back to what we had talked about earlier, if you're recommending resources to folks online, important to think about, what is accessible to them rather than assuming. So are there certain platforms? Do they prefer video versus written information? Is there a specific linguistic or cultural identity piece that's important to them? And are they the sort of people that want summaries of information, or are they looking for more in-depth information as well? And that'll change, are you going to send an Instagram reel to them, or are you going to send them a paper or a PubMed link? Are you going to send them a link to maybe to a webinar, depending on, again, their realities and their preferences of how they take in information? And again, obviously, make sure it's evidence-based. So review resources before you share them. If you're working with a specific community who has practices and beliefs around complementary or alternative medicine practices, or in a larger context, even if there are certain trends or conversations that are happening, important to be aware of those and to have a bit of a repository of reputable resources that you can share. Some folks shared those in the chat earlier. Hopefully you can add Our Kids Health to your repository of resources as well. And also important for us as practitioners, as researchers, as community champions to stay connected. And they call it sometimes social listening, right? Being aware of what are the conversations that are happening in different places. I know some practitioners that will have kind of shadow accounts on social media where they will be a part of bulletin boards, where they'll be in groups as well, just to be able to listen to, what are parents and families and caregivers and youth having conversations about, where are they convening online, and are there things that we can, as a professional community, do to try to create more credible resources, or to help with some of their priorities. There is this notion also of, sometimes we use this term if there's myths. We talk about debunking myths. So if someone has a certain belief that may be based in myths or disinformation, can we help them to essentially, address that, and to give them the truth behind what the myth may be. And then the other idea really is, can we do that proactively? There's this idea of pre-bunking rather than debunking. So is there ways for us in our spaces to be able to help change that narrative, or to get there and dilute out some of the myths and disinformation that we know is getting out to our families and communities as well. I'll pause in just a moment. Wanted to thank our partners and friends that we've made along this journey. You'll see a bunch of different logos from across the country. Again, we're based at St. Michael's Hospital at Unity Health Toronto, but the practitioners that are on screen and our community advisory board members are really across the coast, the country, coast to coast to coast. We have a really lovely partnership with the WHO's Digital Health and Innovation branch, and the Canadian Pediatric Society as a part of this work as well. So it's been great to be able to think about how we can partner. As we think about the future, we're really excited to think about more communities that we might be able to create resources for and with. We have a commitment to engaging with Indigenous leaders to think about what might be a place that we could start to co-create channels for diverse Indigenous communities. We're preparing to launch, actually in the months ahead, our Francophone, and specifically another Black Francophone channel. So we're very excited about that, along with other communities, again, based on the data of who's coming to Canada and who's here. And then also, we've been talking about whether we might be able to create resources that are youth-facing. Everything we've done with Our Kids Health so far has been caregiver-facing. And so we are looking at opportunities and funding to be able to create youth-facing channels that are led by youth, with the support of some of our experts as well. And also thinking about other media, such as podcasts or long-form videos on YouTube as a part of this process. And so, this is a little bit of what we've learned along the way. If you'd like to collaborate, or if you'd like to further the conversation, please reach out to either of us. We are excited, as we said, about being able to bring the latest and greatest in science out to everyone. So if it would be helpful to partner in a knowledge translation capacity or around community engagement, that's something we would be open to talking about as well. And there's my contact information there. I'll put into the chat once more. We welcome, if you want to follow along with our newsletter, or follow us on LinkedIn as we create more content and continue this journey, we would welcome that as well. Thanks so much. And we'll pause there, and we welcome any questions that you folks might have.
Thank you so much, Ripu and Irina, for this very informative and exciting presentation. It was really wonderful. We have a number of questions in the chat, and I'm going to, you've already answered one from Sunny, and Sunny had a follow-up question. Is every team member in the process in-house, including the many cultural adaptation and translators?
Yes, so I mean, they're a part of our team, and so most of most of, I guess, what you're seeing come to life on screen happens as a part of the Our Kids Health team.
Excellent. Yes, Morgan is asking if it's possible to repost the content, and I guess you submitted like links in the chat. Excellent. And Keiko, maybe I can just pass the mic to you. You had a comment as well.
Yes, thank you, Alex. Thank you so much, Ripu and Irina.
Thank you.
That was fantastic. Thank you for accepting our invitation and sharing. Each time I see you speaking, I'm like, yes, we have to do more of that. It was more of a reflection I was having while we were talking, and thinking that we have this initiatives like yours are brilliant and so important, and we're on this knowledge translation axis, right? Trying to translate information, bring it from here to there to different communities. And I wonder how much we're doing on the other side, right? So how are we really building capacity of trainees, of medical students, rehab students, other health professionals, and social services and others, to better understand what are the realities, what are the needs, what are the ways that we have to do. I know a lot has been happening in the research side, in terms of the mandatory EDI boxes that we have to fill in grant applications. But I don't know in practice, in clinical practice, and other spaces, if we are doing the knowledge translation products to teach people or to show people more, right? What are the realities that you have to be translating in your practice every day? So I don't know if you're engaged in these dialogues, because yeah, I've just been thinking about that, how we can think of the bidirectional translation, or multidirectional actually, of knowledge, right?
Absolutely. Maybe Irina, I can go first because I'm unmuted, and then you can hop in if there's something you want to add. But it's been, I think, the idea of knowledge translation and some of the challenges that you're outlining, I think it is so certainly multi-level, right? Like there's so many systemic sort of pieces there. And I think it's important to have these sorts of conversations, these sorts of communities where we can all think about where are we in this ecosystem and how can we do more in those spaces. I agree with you on, are there pieces there upstream around how we're educating tomorrow's professionals around it, all the way to, I think, kind of where Our Kids Health is at is kind of more community integrated, or where the information consumers are as well, and thinking about, are there bridges in between? But I agree with you, multi-level sort of piece. But I feel like we're at a point in history, at least in Canada right now, where we're having these conversations and there's respect and honor for, how do we make sure that knowledge translation, or the knowledge that we're creating is mobilizing out to more people who deserve to have access to it.
Yeah, and just adding to it, we are collaborating with medical students as well at our Digital Youth Fellowship program. So we receiving a lot of impact from them, and we are like kind of, as you mentioned, it's kind of bi-directional way of teaching them how to actually put together the evidence-based resources to families, and we receiving from them the feedback as well, and trying to implement it at our work and with our collaborators as well, with more senior stuff. So I believe like we already starting getting in there with our Digital Youth Fellowship program. But of course, I strongly believe that there is a definite need of this kind of two-way process between like medical professionals, like medical students, to making sure that this content, this evidence-based resources are shared.
Wonderful, thank you. And Connie had to leave, but she had a very important question. How do you choose the languages/cultures to focus on? Are there plans to add more channels in the future depending on demand?
That's a great question and always tricky. So, we tried to be data driven in where we started. So our pilot chapter initially was Punjabi Kids Health. We had gotten funding initially to scale up to the current channels that we have, which was based on census data, again, of who's here, who's coming to Canada as well. And we've just been able to secure funding to launch our Francophone channels as well. So we just had a meeting with our providers yesterday who are interested in being the faces of those channels. So we'll have a general Francophone channel and then also one that's specifically for Black Francophone communities as well. And a lot of it really, depends on funding, that F word that none of us like in the work that we do. But it is, so if, there is specific funding behind being able to create more channels, we'd love to be able to do that. I think we've gotten into a good flow of how we, train the coordinators, how we engage with our communities. Never meant to be a cut and paste, but some important lessons we've learned there. So, if opportunities come up, we'd be really excited about being able to branch out to more.
Mm-hmm. Thank you. Corinne's question: are the learning hubs, the website regularly updated?
Yes.
Yes, yeah, that's Irina jumped in on that because that's an important part of her role. So that's something that we're working to keep up. It doesn't automatically update, so the social media platforms are more up to date, and then they trickle over to the learning hubs that you'll see on the website, and we try to keep it indexed as well. So families can go to specific sections and look at certain kind of pull down menus if they're looking for specific things.
Excellent. I don't know, Irina, okay, but you wanted to add something else? A question from Sally. When it comes to newsletters, do you ask people ahead of time what language they prefer? Do you offer several versions in different languages?
So sadly, no. So at this point, our newsletter is in English. It is meant to be, right now, it is not for caregivers, but is meant for professionals as a part of our kind of our community of practice that has been assembling around this. So our vision would be, it would be great to be able to have multilingual adapted newsletters for the different communities that we work with. Right now, we're doing English only, again, just based on the resources that we have.
Okay, more questions. Sunny is asking, Sunny saying, maybe you mentioned this before, but I'm curious and inspired by your team's process. What does community engagement look like? Is it interviews and focus groups? And how long does the media creation pipeline take, start to finish? What is the biggest challenge or rate limiting step in the process?
Yeah, great.
Yeah.
Those are Arina and I are both smiling because we've got probably lots that we could say about the process that we've learned. In terms of timeline, maybe that's an easier question. So, generally we're kind of thinking on the order of weeks from the time that something is created to the time that it's published. We'll talk about some of the rate limiting steps in a second, but there are certain times where we need to create rapid response content, right? So, for example, when the Trump administration a few weeks ago shared their notions around where autism was being created and, caused this international uproar around acetaminophen use, we were able to post something within 3 or 4 hours there across our different channels because we know families are going to be online looking for information and we want to be in those spaces. So there are times where we'll create rapid response content. And then other times, if it is something that we're able to do that is more intentional and take a little bit more time, like some of the learning hubs you've seen, we're thinking on kind of the order of weeks to months between creating the scripts, being able to make sure that they're peer reviewed by 2 experts, and kind of going from there in terms of content creation and rollout as well. So some things we make happen quickly, when it's a particularly timely topic.
Excellent. And Corinne is our manager at the Child Bright for the engagement program. And she also works with Heather. I think Heather is also here, who's the coordinator for the ENIAC, our Youth Advisory Council. And Corinne says that she looks forward to potential partnerships in the future. Sally, are all videos posted on the same channels, even if they may contain different languages?
No, so right now each channel, we were kind of, it's based on the end user experience, really, right? So the idea is if I'm a Punjabi dad of a child with a disability, then I'm more likely to follow that channel and receive content in that language, as opposed to, receiving things in other languages where I don't see that reflection. It's not as relevant to me. People are more likely to unfollow at that point as well. So it's all created and grouped by cultural linguistic community. So for example, we didn't kind of go into all of the details of this, but Our Kids Health is the banner, and we have an Our Kids Health channel, which is English content, but showcases diverse practitioners on screen that are Anglophone. And then we have the different channels. So I shared the link tree in the chat, which has Punjabi Kids Health, Ukrainian Kids Health, Cantonese Kids Health, etc., across the different channels, where each of those channels then is specifically those providers from that community or those professionals in that language with those colors, etc. Except for, of course, Black Kids Health, which is Anglophone only right now, but everything else is bilingual on those same channels.
Excellent. Thank you so much. We are at 1:56, and I think we're able to answer all of the questions in the chat. This was a very exciting webinar. And perhaps Ripu and Irina, you could let us know again how our community can support you, how we can help, and what type of collaborations you're looking for. If you can remind us, that would be wonderful before we close.
Sure. So really excited to, if folks want to reach out to us. So I think the ENIAC that was brought up about the Youth Advisory Council. So I think we're getting closer to a pilot launch, at least, of some youth-led, youth-facing channels. So that would be a great opportunity to be able to connect, because again, it's meant to be community-led. So speaking with youth about what are their priorities, what can we help them create content on, would be great. And on the other side, if you are looking for collaboration around, KT partnerships in reaching out to some of these communities, or around community engagement, which I don't think I answered that question earlier around how our community engagement works, but we're happy to help with that as well with some of the advisory boards that we have already existing as well. And so happy to do that. In terms of our community advisory processes, so it is pretty flexible. So we've got some community advisory boards and existing relationships already with agencies who work with these communities or champions in these communities, where there are regular meetings where we're able to have those conversations, and we can use that as a focus group type setting. In other places, or with some of our communities, it is more kind of one-off conversations or individual interviews that the coordinator then is having. And then we're also able to do some online engagement as well, using our social media platforms to have people, log in and do a Google form for a survey, a questionnaire, those sorts of things. So there's a lot of different ways that we're able to engage with communities as we are thinking about, what are the priorities and the content we should be creating.
Excellent. So this brings us to the end of today's session. Thank you so much to our speakers and my co-host Akshat for a great webinar today. And thank you all for being here. We encourage you to reflect on how the insights shared during the webinar here might apply to your own work and communities. As a reminder, take a moment to complete our evaluation survey. The link is in the chat. And we wish you all a great rest of the day. Thank you so much, Ripu and Irina.
Thanks so much. Thanks, everyone.
Thank you.
Yeah.
Yeah, bye.